And now we're going to hear from Brooke Abbott, who is the creator of the Crazy Creole Mommy Chronicles and the co-founder of IBD Moms. Brooke is a phenomenal advocate and IBD champion, often representing the Crohn's and Colitis Foundation, the Digestive Disease National Coalition on Capitol Hill. Brooke, thank you so much for being here today. It is so good to see you virtually.
It's so good to see you. Thank you for having me.
Of course. So let's just jump right in and tackle vaccine equity. You and I have been chatting about this. I certainly think that the IBD community has been chatting about this, the autoimmune community, and for that matter, our country and our world. And so, can you tell us a little bit more about what you're seeing and hearing regarding COVID-19 vaccine equity?
Well, I'm on the West Coast. I'm specifically in Los Angeles. So we are in a bit of a pickle right now. We've got, a rollout that wasn't necessarily clear. And there really wasn't any guidance or equity when the rollout happened. Well, all over the nation, but specifically for us, because we were hit very hard recently with COVID-19. And so you had mostly people in the medical field who were trying to get their vaccines. And then there was the whole miscommunication about people with autoimmune diseases versus people with people who are over 65 and then people who are 75 and older. And then we're also very close to other counties, and Los Angeles County itself has it's very large, but it has its own way of doing things. And so the surrounding counties were definitely doing their own thing as well. So it was all very confusing. And, there wasn't a lot of education given out to a lot of the seniors and disabled people that were able to get their vaccines after the medical community could get theirs. What was frustrating to me, I tried to help my grandmother navigate the website, and I consider myself pretty technologically savvy, and it was incredibly frustrating. To a point where my 11-year-old was standing by. They're always like, well, clearly you don't know what you're doing. Let the Gen Zer get in here. And he was still like, this thing keeps refreshing. It won't let me do this. It won't let me do that. And so I can only imagine what it was like for people who are not as technologically savvy. Also, there was a lot of misinformation on the internet about the vaccines. And, we know that a lot of our parents and grandparents are now on Facebook. And so they're reading stuff and they're sharing stuff, and they are not necessarily deciphering between real information and some of these clickbait sites. And, once you click on one of those sites or click one of those memes, you're just trafficked all this information that is very similar to that. I am very fortunate to have older women and men in my life who are very educated about vaccines and, are not necessarily scared or have apprehensions. But I know that a lot of the people in my church community, in my neighborhood, and just in my overall ethnic community as a whole, we're having a lot of questions and a lot of concerns. And I saw them predominantly when my grandmother posted that she took her picture, she got her, her shot. Clearly I'm influencing her.
I love it.
My mom took a picture of her and they posted it on Facebook. But when I saw the comments, it made me sad because there were so many older people who were petrified of what was in the vaccine, how the vaccine was rolled out, who was behind the vaccine. Most people were scared of the speed of the vaccine. And one thing that really kind of frustrates me about the last administration was there wasn't a lot of education coming out saying like, this is why it's coming out so fast, because we've put all the money that we haven't put behind anything ever in life behind this to get a hold of this so that we can move on and focus on the other diseases that we need to tackle. But, with the underlying fears and the generations, decades upon decades of misinformation, about medicine and science within the Black community, the actual, well, it's a disconnect. That's what it is. It's a disconnect because for a long time, Black Americans were forced to take care of their own. They were, I mean, I have one parent who was born in a segregated hospital. I'm 37 years old. So it's not like, we're 2 or 3 generations away from medical inequities.
Absolutely. And I know this is something we're going to dig into a little bit more. And I'm just thank you for touching on so many different, when we say inequity, that can mean a lot of different things. And you did such a beautiful job touching on how this is impacting the elderly, the disabled, ethnic communities. I think that there's across the board, admittedly, this could have gone a lot differently for a lot of different reasons. I mean, even you were talking about the technology piece. Even I, here in Massachusetts and living with, I haven't shared this on this newscast yet, but I also have a few different autoimmune diseases. And that's how Brooke and I know each other. We're both members of the IBD community. And I was looking to see, all right, we're starting phase 2. So who's included? And I honestly still don't know. I was looking at this yesterday. I still don't know if I'm included in phase 2 because the language is too vague. It's not particularly clear. The site's crashing. So, a lot of issues there. But one thing that I did want to touch on, and that you just started to address towards the end of that last question, is that many members of our autoimmune community are Black and brown women specifically, because 75% of the people with autoimmune diseases are women, who have had unjust encounters with our medical system. And so would you be able to speak to some of the history here that has fostered this mistrust and thereby is impacting vaccine hesitancy?
Absolutely. There was a brilliant movie made by HBO about the story of Henrietta Lacks. And I think that her story is very poignant because it wasn't centuries ago. Her cells were used to create a lot of the vaccines that we enjoy. And her cells were used, and not only was she not compensated, but she wasn't even recognized. And she was not asked. They were taken during, basically she had cancer, and they were taken during her medical exams. And they were used, and they have helped so many people, but for so long, her family, didn't even know that she was a part of these scientific miracles. And then you have the Tuskegee experiment, where Black men were actually given a disease and then not allowed to be treated for it because they were studying them and they didn't even tell them. And once, the vaccine for that disease came out, they weren't given it. And this actually ended in the 1970s when someone blew the whistle. So you've got people who know that for so long, Black Americans have not been treated humanely in any sense of the form. The systemic racism in this country is so deep that we can't even begin to find ideas to figure out how to unravel it, because it's everywhere. It's subtly, it's financially impactful, it's emotionally impactful. There's this idea that Black women, I laugh because I'm such a wimp. So it's funny to me that Black women are, because, we've had to endure generational trauma of things. We scientifically apparently can handle pain more than other people. And so you see that sometimes when you're in the hospital and you're, I don't care if you're an educated patient. I don't care what your financial status is or your social status is. I know people from the poorest of poor to the richest of rich who have literally not been listened to by nurses and doctors, who have not been given adequate pain medication, who have been, pricked several times with needles because apparently we can take it and it's no big deal, who have been told that there's no way that they could have the disease or the symptoms that they're having. There's just all these little things that, you know, after a while you get exhausted. It's exhausting. And I feel like if I wasn't an advocate with all the diseases that I have going on and all that I have to do, and I have a son who also has chronic conditions, I don't know that I would be as trusting if I didn't know, if I wasn't as educated and I didn't know the people behind, you know, some of these medical advances, and knew such great doctors. Because when you do have a series back to back of bad experiences, you get shut off. And we also have to remember that it wasn't long ago that Black Americans could only go to certain hospitals, could only see certain doctors, and some doctors weren't specialists or weren't able to practice that specialty, weren't allowed to, you know, even some Black doctors weren't even allowed to be certified for certain surgeries. And so then you had Black Americans who were not getting treated at all. So there is a generational mistrust. And when it comes to vaccines, you know, we haven't seen much representation in clinical trials. And it's a double-edged sword, because companies and labs are not reaching out and speaking to communities of color. They are not going the extra step. There are a lot of nonprofits that are not taking that extra step to reach those communities. And then you have people in my community, I can speak for my community specifically, who feel that they're being experimented on and don't have the education to make, you know, the decision on being a part of a clinical trial, and also are also seeing that there is no representation. So it's like, I don't see anybody there, so I don't really trust it, but I don't want to do it myself because I'm scared, because I'm not sure what, you know, what could happen. So there's a lot of conversations that need to be had. There's a lot of information that needs to be had. And I think it starts with, we have all these amazing scientists and doctors of color and advocates of color. And there were so many that worked on this particular vaccine rollout. And I know that now, you know, they're being utilized to have conversations and, you know, they're on television, but they're not in the churches, they're not in the barbershops, they're not in the hairstylists or in the hair salons. You know, my mom's a hairstylist. I know for sure that Black folks get their best information from the barbershop and the hair salon and the church. That's just, you know, this is where we have gotten together. And then those conversations are taken to, you know, dinners and meetups with our cousins and our aunts and our uncles. And that's how those conversations go. It's building trust within the community, with folks from the community. And no one's really taken the time to put an effort in that type of rollout. And it's going to take money, it's going to take time, and it's going to take, it's going to take the want. You're going to want, you know, you have to want to make this real and make it equitable. And if you're not doing that, then no, you're not going to find the money or the time or the people. And that's unfortunate, because we're just going to keep, this thing is just going to keep spiraling if we are not educating people to the gravity of what happens if we don't vaccinate most of the population, and if we are not in some sort of herd immunity by the end of 2021.
Absolutely. Oh my gosh, so much to unpack there that you just covered. And I couldn't agree more. I feel like we need to take this segment of the newscast and we need to broadcast it to everybody who is working in this field and working on distribution, because it's absolutely critical that we do, just as you said, that we are really taking a boots on the ground approach. So what would you say to any of those women watching who may be hesitant about getting the COVID-19 vaccine, especially women of color?
Yeah. It's so easy for me to say, like, trust the science, right? That's like super easy to say. As a mom, it's important for me to find information, and I know that it's important to the women who are watching this to find the information, but it's where do you find the information, right? There are some really great resources. I can speak specifically to the IBD community, and to the mom community, but I know, for sure, checking out all the IBD advocates who are associated with IBD Social Circle, and like I always promote her because she's like the smartest person I know, honestly. Like, I love her so much. But Amber Tresca About IBD is genius, and she always has information. It's fact-based, it's vetted, it's cited. And it just makes sense, and she's a mom and she gets it. And so finding advocates like her and doctors who are really researching. I know Dr. Rutland, he is a pulmonary specialist, but he really breaks it down for people, and those are the people that I like to follow. Those are the people that I like to get information from, because they're speaking to you in the way that you understand. They're not trying to talk over you. They're not trying to give you information that's too much. They're literally giving you what you need to know and what you need not to feel comfortable. I want people to give me information that will allow me to make an educated decision. So, about IBD, Dr. Rutland, Dr. Rubin is really great. The Crohn's and Colitis Foundation is putting out a lot of information. Like, there's all these people, they're all on Twitter, and they're all on there, and they have information that you can easily read. And if you can't understand it, then keep asking questions. But what I hope that people are going to start doing is not taking the meme or the video that they see on Instagram and Facebook and Twitter that kind of validates their worst fears or validates, their idea, whether it's positive or negative. This is an important moment. This is our moment to really take the reins over our health and follow through and take control. Getting vaccinated, beating COVID-19 is our moment. This is our moment to take control and make us all safe. And we have that opportunity. So I'm going to ask everybody to do just a little bit of work, take a little bit of time and research. And it's more than going to the sites that you normally go to. It's it's more than watching some YouTube. It's more than that. It's finding people who have the actual information, and finding the people that you can ask questions to, who aren't going to give you trivial answers. But find us on Twitter, because we're all having that conversation, and all of your fears and your concerns are valid. I want people to understand that. And I hope that doctors and scientists are understanding that too, that people's fears are valid.
Absolutely.
Because of experience and because of what they're hearing. So we got to hone in, and we've got to come together, and we've got to ask questions, and we've got to research.
I love it. I think that's the perfect way to end this segment, to do the research, do the work, and support one another in answering those questions. Brooke, thank you so much, as always, for your incredible insight and for really illuminating how history is impacting what's happening with our vaccine rollout today and what we can really do to address that. So I do encourage all of you to please follow Brooke and follow, as she said, Amber on social media. They are collectively IBD moms, and they are brilliant. And I am just honored to have the opportunity to know them. So thank you so much for joining us, Brooke.
Thank you for having me. This topic is so important, and I appreciate you guys really doing this.